Hi, I'm Nicole Cutler, a licensed acupuncturist and holistic health advocate. I'd like to talk about the sexual transmission of the hepatitis C virus. Presently, an estimated 4 million Americans are presumed infected with hepatitis C. As the number of people realizing they have this contagious virus continues to rise, so does the concern of how they were originally infected with this disease. Medical experts agree that hepatitis C is primarily transmitted through the blood. While a majority of hepatitis C infections are contracted through intravenous drug use or tainted blood transfusions, an estimated 10 to 30% of those infected do not know how they got hepatitis C in the first place. With such a significant percentage of people infected with this virus unsure of how their disease was acquired, just about every possibility becomes suspect. Physicians are not unified in their opinions about the sexual transmission of hepatitis C. Some assure their patients that getting hepatitis from sex is extremely rare, while other doctors tell those infected that they likely got it from sexual activity. When someone in a relationship learns they have hepatitis C, there is often a great amount of fear of passing the virus on to their partner. In general, the medical literature has concluded an extremely low incidence of sexually transmitting hepatitis C. The risk of sexual transmission in a long-term monogamous relationship with a partner infected with hepatitis C ranges from 0 to 0.6% per year. This risk of transmission is slightly higher, about 1% per year, if involved in a short-term sexual relationship with someone who has hepatitis C. This risk increases if the infected partner is co-infected with HIV, the virus that causes AIDS. Some studies specifically looking at monogamous heterosexual relationships found that the likelihood of sexually transmitting hepatitis C is either low or non-existent. According to the Hepatitis C Partner Study completed by the Centers for Disease Control in 2004, the risk of sexual transmission in the United States is 2.2% in monogamous heterosexual relationships where one partner has hepatitis C. As published in a May 2004 edition of the American Journal of Gastroenterology, researchers found that the risk of sexual transmission of hepatitis C within heterosexual monogamous couples is extremely low or even null. As published in an April 2005 edition of the American Journal of Gastroenterology, researchers found that out of 216 hepatitis C negative individuals with opposite sex hepatitis C positive spouses, 0 acquired hepatitis C during their study's 3-year period. While the risk of transmitting hepatitis C in heterosexual monogamous couples is extremely low, there are some factors that increase transmission risk. The risk rises for the following 4 scenarios. The first is HIV. When the person with hepatitis C is also infected with HIV, there is a much greater risk of passing on hepatitis C. Although scientists don't yet understand why, it appears that those who are co-infected have greater quantities of hepatitis C genetic material in both seminal and vaginal fluids. The second is high viral load. When someone with hepatitis C has a high viral load, the likelihood of them passing the virus on increases. The third is having frequent new partners. Several studies have demonstrated that those who have frequent encounters and multiple sexual partners have a higher risk of contracting hepatitis C. The fourth is rough sex. Since the membranes that line our sexual organs are more delicate than other parts of the body, they are naturally more vulnerable to injury. When this mucosa is damaged from potentially vigorous sexual techniques such as anal intercourse, fisting, and the use of certain sex toys, the risk of blood exposure rises, and thus the risk of hepatitis C transmission rises. The risk of transmitting hepatitis C through sexual contact is low, especially for heterosexual, monogamous couples who do not have the risk factors previously described. However, there is enough evidence to conclude that sexual transmission of hepatitis C is a possibility, especially because so many do not know how they contracted it in the first place. Until the medical community establishes definite guidelines to prevent spreading this virus, practicing safe sex is the only reliable method to prevent the sexual transmission of hepatitis C.